Once again, my name is Calabar Doctor, and if you've been following this page, you know I discuss everything about diabetes. But today I'm going to talk about something very important. Five signs that you are potentially going to die in 5 years. Don't worry, I'm not here to scare the hell out of you. I'm just here to educate you properly so that you can inform the next person. So let's get into the video. Number one, excessive fatigue. End-stage kidney failure or chronic kidney failure causes the release of toxins that are damaging and dangerous to the body stream. Now, these toxins affect your muscles and lead to excessive tiredness. If you find yourself being excessively tired all of a sudden, you don't know what is happening, but you are just tired, especially if you are diabetic, because remember that one of the complications of diabetes is what we call diabetic nephropathy, where diabetes attacks the kidney. You could have what we call uremia, which is a complication of end-stage kidney failure. You may think that you don't have chronic kidney failure, but so does the other 11% of the population who actually have chronic kidney disease but do not know. Now, let me tell you that chronic kidney disease affects 16% of the population, and I can assure you that it's getting worse in Nigeria because of our abuse of drugs, our smoking, our drinking, and especially consumption of things like agbo, igbo, and the rest of them. Chronic kidney disease is becoming a thing. Many people are having their kidneys shut down, especially people that are also bleaching. If you are diabetic, you have a high risk of developing chronic kidney failure. So how do you tell? How do you diagnose this? Kindly tell your doctor that you want to do a renal function test. And when the test result comes out, it will contain things like your serum electrolytes, creatinine, urea, and other components of the kidney. But ask your doctor to help you calculate what we call the glomerular filtration rate. This tells us how your body or your kidney is able to filter out the substances that it is supposed to filter out. Because if it does not filter them out, it will accumulate back in your bloodstream and cause some of these complications that we're discussing about. Chronic kidney disease is one of the easiest steps to tell that you have a poor prognosis in the next 5 years. Now, when your doctor calculates your glomerular filtration rate for you, what we usually call estimated GFR, if it is above 90, you are safe, there is no problem. But if it's less than 90, then there is a sign, or that could be a marker that something is going on with your kidney. Ask to see a kidney doctor called nephrologist, a renal doctor. When you do, he is going to give you a thorough check and find out your risk factors of developing kidney disease, especially if you've had it already and you are not aware. The earlier, the better. Number two, if you are having difficulty concentrating, especially in tasks that you used to be able to do very easily before, it could be a symptom that you are having what we call uremic encephalopathy, which is toxins from the kidney affecting your brain. So kindly get yourself checked. Again, how you can check this immediately is to do a renal function test. If you are diabetic, once again, your risk factor of developing a kidney disease is high. So ensure that you are checking your estimated glomerular filtration rate and ensure that you are checking your serum electrolytes, urea, and creatinine every year. If you are diabetic and you have never heard of this test, that is wrong. I'm going to do another video focusing on the different kinds of tests that all diabetics should be aware of and how regular you should do this test. Number three, the third symptom is swelling. If you notice that your legs or your ankle or your abdomen is becoming swollen, these are usually signs of three illnesses, either a cardiac failure, a liver failure, or a kidney failure. But in summary, it boils down to the failure of the kidney to excrete excess fluids in the body. So as a result of gravity, the fluids accumulate in the lower segments of the body, which is your lower extremities, which is your legs and your knees, your ankles. In many cases, it could even rise up to your abdomen. So if you notice any of these symptoms, there is a high risk that your prognosis, that is the outcome of your next 5 years, is minimal. But if you notice swelling on one side of your leg instead of the both sides, that is a medical emergency. Rush to see a doctor. You may be having what we call deep venous thrombosis. Please see your doctor urgently. Number four, shortness of breath. If you notice that your breath is becoming short, especially on mild or minimal exertion, you're having difficulty breathing on small minimal labor, maybe climbing the steps is suddenly becoming difficult. It can be a symptom of kidney failure. It could also be a symptom, usually very often a symptom of heart failure. Now, these are symptoms that tell you that the next 5 years of your life may not be sure. And there are always results of prolonged medical issues like hypertension that has gone unnoticed, unmanaged, and some even renal diseases, renal illnesses. Kindly go to the hospital immediately. I've had patients come to the hospital 3 months after developing shortness of breath, 3 months, 4 months after developing difficulty in breathing. And most at times, we always lose those sort of patients because they did not come early. The management of patient requires early diagnosis. If you see your condition, if you notice that your body is abnormal in any way, please rush to the hospital. Kindly visit any hospital near you and table your complaints to the doctor so that you could get help. That is why doctors are around. And when you stay for a long time before you visit the hospital, people will now say, oh, it's after he visited the hospital that he died. He should not have gone to the hospital. Doctors are there to guide you. Doctors are there to save your life. So make use of them, pay for it, and make use of them. And the last one is changes in urination. If you find yourself urinating frequently, if you find yourself foaming in your urination, if you find that you're unable to hold urine, if you find that your urine is bloody, it could be telling you different things about your kidneys. And notice that many of the things we've talked about in these 5 potential signs that you may be dying soon in the next 5 years revolves around the kidney. So treat your kidney with extra care. Be very careful about what you take, the drugs you take, what you consume. Avoid energy drinks, avoid alcohol, avoid cigarette, avoid agbo, igbo, whatever those herbal concoctions are, whatever is mixed inside alcohol, avoid them. They are not helpful to you because at the end of the day, your kidney has to excrete them, work on them, metabolize them. You are damaging your kidneys. So help your kidneys. I forgot to mention bleaching. That is almost an epidemic or an epidemic in Nigeria. So let us, avoid these things that, are avoidable. Now, for my friends who are very nerdy, I want to find out where this research, where these points are coming from. I'm going to add links in the description below so that you can find out the research that led to this video. And just before I go, the prognosis for heart failure is similar to stage 3 cancer. The 5-year death rate is almost the same. The prognosis for chronic kidney failure is poor. Definitive treatment is kidney transplantation, which is a whole lot and requires a whole lot of medical care and advice, and not everybody gets to receive a kidney. So why not protect your kidneys? I'm going to do a follow-up of other investigations that all patients that are diabetic need to do every year, but for now, bye-bye.